Hello, everyone. Thanks so much for taking time to watch our series of COVID interviews. And I would like to introduce you to Maranda Miller. And Miranda interviewed with us back in April when things were getting started and we really weren't sure what was coming our way. And I would like to just talk with Miranda now, 8 months later, and let her share with us some of the things that are maybe lessons learned or maybe some stories that Miranda has experienced and is able to share with us. So let me just start by asking you, Miranda, how are you doing?
Doing well. I think now that we are a little further into this, I think that there's been some mind shifting that's happened as well, that we are starting to see potentially the end of this marathon or maybe a shift in the marathon a little bit. So that's exciting. I think back in April, it was really hard to know what it was going to look like. And so there seems to be a little bit more known all the way around, and that's helpful.
How are you and your family doing?
Really pretty well. My kids are very fortunate. In our region of the state, we do get to do in-person learning. And so they've been in school most of this time. They've only had to be out of the classroom, just one of them, for a very short amount of time. And so school doesn't look the same. And I totally recognize that, especially as my team is working in the school as well at work. But it definitely is helpful to have other eyes on them, for them to at least be somewhat with friends and to be able to still learn in person, which we know is by far the best way for most of our children. And then for my husband, it's work as usual. He works in the agriculture field, so that has been able to stay the same. And I have really adapted to working virtually more than I ever thought I would. I think that it's worked pretty well for most of the things I needed to.
So let's talk a little bit about your work. So share with us how it's changed for you, not only just working virtual, but as well as your interactions with your coworkers and with the community.
I can first of all start with that most of our services are now virtual, whether it be the outpatient clinic of Centennial. We offer most everything via telehealth still. And then for my team, we have worked with our national partners, such as Sources of Strength and Mental Health First Aid, and we now can offer those trainings virtually as well. And then the team is very creative and they have designed videos for some of our curriculum that we can send to schools as well. What we've discovered is most of our kids, like I said, are in schools. So we have also been granted permission from our leadership to go into the schools, as not all of them, but those that really would like us in the building, and be very careful with our protocols around doing that. So that's been really nice. And then I would say too that for me, working virtually, meeting up with my team, they're a very extroverted group. And so Zoom is actually a lifesaver. I think that we're a little fatigued with Zoom, but at least we get to see each other. And so that's been really beneficial.
So you mentioned the schools, and for the listeners that aren't familiar with Sources of Strength, could you just briefly share what that program is?
Yeah, Sources of Strength is an upstream suicide prevention program. And I say program, but it really is a cultural shift within a school. And so it really is about hope, help, and strength. We want our kids to know that we don't get through life unscathed, that we will certainly have tough times, but that we have strengths that can help us through those tough times. And there are 8 strength areas that we focus on. And we train a group called peer leaders within the school that are chosen by school staff, that are seen as real leaders, and not necessarily your student council kids, but a wide, diverse group from all corners of the school is what we're looking for. And then we work with adult advisors in the school. Those can be our teachers or other staff of the school district, or even in the community that really care about our kids. And they help come alongside those peer leaders and help guide their work. And what we have the schools do, what we have the kids do, is make campaigns around those 8 areas of strength. and they come up with some really great ideas. And one of the main focuses that we have on sources of strength is the trusted adult piece of it. That we want all of our kids to have at least one adult that's a trusted adult that they would go to if they were struggling. And the program is designed that the kids that are peer leaders are not to be junior psychologists, but they are to be agents of change and connectors to hope and help. And that's what we really want. And so many of our school districts have embraced sources of strength. There now is an elementary version of it, which is really exciting to start those conversations even younger.
So, have your sources of strength groups been active these last few months?
They have. Thankfully, Sources of Strength, the national office has given us some very easy, very doable campaigns that can be done virtually. And we've also been able to train them virtually as well. We do a yearly training with each school. And so been able to do all of that. Some schools I think are doing more work than others, just depending on the structure of their environment. Some of them are hybrid school situations where the kids aren't there every day, or maybe they've had kids that have been quarantined for a while. And so or staff that haven't been out as well. So I would say that they're trying their best, but probably hasn't been as robust as they would like it to be. With that said, the nice thing about sources of strength is it can be done just in very simple ways, and we've been working with our schools on that as well.
So, since you do have many of the kids working virtually, and all kids we know respond to that differently, share with us, please, some of the challenges that you've seen, not only maybe with kids, but even with coworkers and community members.
I think being virtual for so many people, it has been a little bit difficult, and our kids too, to feel that they're fully engaged, and you miss that in-person connection. And so I have seen that, and I think it's also hard sometimes to stay motivated when you're in your home environment. There's other things that come up that need your attention, and so that can be a little bit of a challenge too. And I remember that early on when I started working virtually, that even our dog became, I thought, way needier than he usually is. And then even my kids understanding that when my home office door is closed, that I really am not available unless it's an absolute emergency. So that's been a little bit of a learning curve, I think. And like I said, we do miss that human interaction. That's actually that in-person piece of it. And it really is the hope and the desire to go back to most of that, although we don't intend to get rid of our virtual platform either. And I think a lot of organizations, and I think some schools probably won't either, knowing that we don't want people coming into our buildings that are not feeling well. And why not have them meet with us virtually? And I'm thinking schools are probably feeling the same way. Why not have some virtual things done as well, just to keep people healthy in general?
Mhm. That's very interesting. So, what about just in general the morale that you see in your community?
I think there's some ups and downs. We're a very rural part of the state, and so our needs look different than the Front Range for sure. And I think that that's been difficult for many of our residents out here, because while we're being hit by COVID-19, it has taken a little bit longer for that to happen in our area of the state. And then just we are naturally able to isolate a little bit more out here. It's not a new phenomenon to us to have people that live far from any of our major towns and things like that. And so I do think that's a big piece of it. But certainly, you think about rural communities, we're pretty resilient people, and so and pretty innovative in the way that we approach things. For instance, many of our counties were able to have county fairs this summer, and that was a huge success. And it was not that it was the normal county fair, but our kids at least got to show livestock and still have it centered around 4-H and FFA and some of those pieces of agriculture. So certainly some things are business as usual in our area of the state. With that said, our healthcare and our assisted living and nursing homes are being hit very hard by COVID still as well. And so it's not that we're not being impacted by it, it just looks a little different. And certainly one thing that our kids, many of them engage in, and it's kind of a how school or how the community, supports the school is through athletics, for instance. And some of our kids are really truly missing play sports like they normally would get to. But those kind of things are sometimes out of our control and really can't always be mitigated by some of us. So certainly it is having an effect for sure.
Mhm. So, where are you in when we talk about rural Colorado? Where are you? And since you are rural, where are some of those places that the farmers and ranchers and folks can go to still have that connection with others? Do they go to the sale barn or do they go to the coffee shop?
Yeah, I think there's still a lot of that. I think the sale barn obviously is one of those places that we've always met up with our agriculture partners. And it seems like a natural place. Like I said, 4-H and FFA, the Colorado State Extension Office, places like that are really being very supportive, as well as our faith-based communities. I think many of them are doing live streaming over Facebook and other methods like that, but also people are able to still go in person. And so I think that certainly helps as well. And then I think just those few interactions that we do get, when people need to buy livestock, sell livestock, buy farm equipment, sell farm equipment, those things still need to happen. And, harvest still had to happen this year. All the harvesting needed to be done and that was accomplished. And so those kind of things, those relationships are still very, very much intact.
So that's very fortunate in your region, right? Because in some places that's just not, it's not as accessible. So, is there anything that you would like to share with us about support that you wish that you had gotten, or maybe support that you did get that has gotten you through this, both professionally and personally?
Wow, I would say professionally first. Our organization really took it on right away to get us up and going virtually as much as possible, as quickly as possible. And like I said, those national partners that we have at Sources of Strength and Mental Health First Aid and other agencies like that, they are innovative and they got things rolling right away. And that was very comforting. I think is the best word for it, to know that they want us to continue to do our good work. And so we are not wanting to be a part of spreading COVID-19 at all. We want to, keep that to a minimum. And so obviously being able to work from home and having that flexibility has been wonderful. The other piece of it is personally, I would say that this is the most time, and I did a little reflection with this with my supervisor yesterday, that I've ever gotten with my children. My job being across 10 counties and 17,000 square miles and also doing some work statewide has not lent for me to be home a whole lot at night. Sometimes I was in hotel, be in hotel rooms and be gone. And so I have noticed it be very helpful to my family to have me home more. And so that's my hope, is that we can strike a good balance when this is all over of being in person and being virtual. I think there's a great place for that. And then I would say, going back to a little bit of professional, though, I do want to mention is that I've gotten the opportunity to attend some statewide and national conferences that were usually cost prohibitive in the past, just because of budgets, because of travel and lodging and things like that. And we've been able to do those virtually. And so even to grow, professionally has been really a wonderful thing.
Yeah, that's great. So, are there any stories that you would like to share, things that just stand out for you that you experienced, or maybe someone else experienced during this long period of change?
One story I'd like to share is that we have a local cafe here in town, and when things really were at their highest, back in April and March and April and May, pretty much, they were offering free meals to anybody. They didn't care who it was or where they came from. They had a free meal available. And now, because we've seen obviously a very big increase in COVID cases, they're doing that again. And I
Wow.
just think that speaks to how much they love our community and in all of our people that live in it. And for them to say, we're going to make sure people are fed, because it's such a basic need. I know we've also received more money at Centennial Mental Health Center for housing and homelessness. And because that has been on the rise during this time, and to be able to support people and having a place to stay and to live that is healthy for them. So big
Mm,
piece of what's going on. And that same cafe that I referenced a minute ago, also the county fair added extra money to each child that sold their livestock at the sale. And they did that for, like I said, for every youth in Logan County. And that was pretty awesome of them as well, beyond awesome. So I would just say that I watch people really learn to find new ways to connect and to reach out to each other. There's now these wooden boxes around town, many of them are at churches, where people can go and access more food if they need it, and people can donate food there and just leave food in there for people to access. So we're trying really hard, and I'm watching the school personnel making sure that kids are fed, no matter if they're in remote learning or if they're in the buildings. And that's been pretty phenomenal to watch. My hat is off to all of our educators and our healthcare providers. I think they all are heroes right now. They're doing some really tough work with our kids and with our communities. So I would say that that is some of the really, really humbling things I watched come out of this. And I never doubted it at all because I know that people care, but it's been really nice to see that too. And then also just to have the support from state agencies for the work that I do and that my team does. We've been outreach to by a lot of them to say, how can we support rural Colorado in a different way, and what do you need, and to spend some time strategizing about that we don't normally have time for. So that's been a wonderful thing to watch.
that's so great. So, tell me what you and your family are doing together since you do have more time with your family. I'm sure that it's really just changed everything for you. And I'm sure that your pets are even really thrilled to have you home. So what do you do as a family in order to keep things exciting and to keep everyone together and growing and also one other thing is that since you are with your family so much, are the things that you did not have the time for that you're able to really dive in and give 150%?
Yeah, so some of the things that we're doing differently as a family is, especially during the summer, we spend more time on our property. We're lucky to live on a small acreage, and so we planted a garden together. And my son really wanted watermelon, and I've never gardened to begin with. And I did a little Googling, and watermelon is really hard to grow, but we had huge success with it. And I think it's because we were home so much, because obviously watermelon requires a lot of water. So that was a huge thing. Getting to work with the kids as livestock, they both show in 4-H, spending more time with them. And then this winter now, really doing card games and watching Netflix together and just cooking together as well. I I want my kids to both know how to cook so that they survive in college, and what a great opportunity to get to do more of that. So that's a lot. And then actually being very mindful of not wanting to spread COVID, but spending some time with some of our close friends that are actually close neighbors to us, and just spending time with their family too. So there's a lot of those kind of things I think that have come out of it. And um, your other question was about, I started talking, all of a sudden I'm like, wait a second, I think there's another piece to this.
Some of those things that you didn't have time for before that you now have recognized that you can give attention to.
Yeah, so one is, I think, having more meaningful conversations with my children. I I I train people to do that. It's a big part of the work that I do, is that we make sure that we stay engaged with our kids. But this has given me another opportunity to really spend time with each of them. I only have 2 children, and so to divide my time is not that difficult to do. But to get them each meaningful time with me has been really great. And for them to have meaningful time with my siblings and my parents, and they really enjoy that as well. So that's one thing that I hope that we get to continue. I do believe that there are so many conversations that I I've had with my kids, but kind of in passing. And to actually get to sit down and have them in a more meaningful way has been great.
So So we can't go without you telling us how the watermelon crop turned out.
Well, I tell you what, we almost could have gone to a farmer's market because we had several of them that ripened at the same time. And even learning how a watermelon ripens was a new to me, new territory. We've planted three different varieties, and we now have it narrowed down to two that were way more successful than the third one. The third one was called Sugar Baby, and you would have thought that that one would have done better. They were just a little more difficult to discover if they were ripened or not, and so that became kind of an issue. But we were able to we would have several ripe at the same time, like I said. So we loaded them in the car and dropped them off on people's doorsteps. So we're those kind of people because what else do you do with them? So, but they turned out really good. Fresh, homegrown watermelon. There's something to be said for that. It's pretty darn good.
That's so great. Was there anything else that you'd like to share with us, Miranda?
I can't really think of anything. I thank you for this opportunity.